Welcome to the Quality and Patient Safety series by BW Healthcare World. My name is Harbinder Narula, and my guest today is Dr. Malathi A, who is the Group Chief Medical Officer, Group Chief Quality Officer, and the Academic Head at Aster DM Healthcare. With an MD from Bombay University and advanced training in hospital administration from the Tata Institute of Social Sciences, she has over 15 years of experience, which also includes working at the Manipal Group of Hospitals. Since 2015, she has been leading Aster DM Healthcare's efforts in patient safety, clinical excellence, and quality improvement, driving digital transformation and ensuring compliance with international accreditation standards. Her work has been pivotal in achieving high clinical outcomes and enhancing healthcare delivery. Let's speak to her to understand if accreditation helps in setting standards and improving quality care in hospitals. Welcome to BW Healthcare World, Dr. Malathi. It is such a pleasure to have you with us today.
Thank you very much. Pleasure is mine.
Dr. Malathi, with your experience that you have in quality, patient safety, etc., can you explain what hospital accreditation entails and why it's an important thing for healthcare facilities to include accreditation as a part of what they do?
Thanks so much. I think it's very, very pertinent first to understand what is accreditation before we go into further details. And first, let me give you a briefing. It just means there are set standards. When I say set standard, it just simply means in a layman's language, how do you follow certain processes, procedures, outcomes from a patient's perspective. Now, if you want to have good, safe care for a patient, these should be certain standards so that it can be applicable across all hospitals, big or small. Now, when we say there are established standards, we also require somebody, an external pair of eyes, which we call as the external body, the external auditors. You can call them as assessors. And this external body could be national or international, like it could be NABH, it can be JCI, it can be Australian, it can be any one of these. These are the external bodies would like to come and check whether you conform or you adhere to these standards. This process where an external body comes and checks whether you are adhering to these standards is simply called as the process of accreditation. That is what it entails. It just says, does the institution adhere to standards, which are set standards? And that is what we do. But before the body comes in, the institution does what is called as a self-assessment. They first try and see where are my gaps, and then they try to close. But then you can't audit yourself. Audit is always done by someone else. And that is what an external body comes and checks and sees how far are you away from the standards, gives you an opportunity to close them, and therefore you improve the healthcare. That's the perspective of accreditation.
And Dr. Malathi, is it just about getting accreditation, or does it genuinely contribute to improving the quality of care that patients receive in a hospital?
Absolutely. The purpose, or I would say the goal of accreditation, is to ensure that the person who receives the care and the receiver is benefited by that. And therefore, in the process of accreditation, because you are adhering to the standards, it would mean that the receiver gets the best of the care. And when I say best of care, in simple terms, what does it mean? Is the care safe? That's what, because every patient would like to come to the hospital because he trusts that he is going to get a care which is not only entails quality, but it also means it is going to be safe and secure. He does not want to come to a hospital and land with more problems because he is already sick. Therefore, he does not want to come to a place and gets a hospital-acquired, say, infection. Therefore, when you have an organization which has got accreditation, it simply means processes and standards are in place. And we always say quality is as judged by the receiver and never the provider. And here the receiver is the patient. So the patient judges how you are delivering care, and accreditation sets the norms or the basics to ensure that the patient gets the best care. So it is all about safe care. It is all about efficient processes, and it is extremely important that it is delivered by competent people. And that is what I mean when I say competent healthcare providers. It's not only the doctors, it is the nurses, the paramedics. So standards are set. So that's what the patient benefits when the particular institution is accredited.
And ma'am, you've been in the industry for a very, very long time. You've seen institutions get accredited, and then you've seen the difference between what it was earlier and what it is today. So from your experience, what are some of the examples that you could probably share where you have seen the patients positively impacted when it comes to safety and outcomes?
Yeah. So let me say, when we look at what are we actually measuring, see, anything that you measure is extremely important, because what you measure is what you monitor, and what you monitor is what you can improve. So what does accreditation allows you to do? It has already set a standard. So when you set a standard, you are able to measure it very objectively. So I've seen with experience, and for many people who have been in the healthcare, you measure your outcomes. That is the best way. I can say, oh, the care was good. But from a patient's perspective, what do you mean by good care? Because for everybody, the good could be very different. What is good for me may not be as good for another person. So you need to have very tangible, measurable outcomes. So accreditation helps you to measure your outcomes. For instance, I would say that you tend to have a decrease in the errors, first and foremost, because errors is something that you do not want in a healthcare industry. As compared to any other industry, you cannot say that, sorry, I made a mistake, because it's a life and death situation. So you want to be as close to perfection as possible. You cannot probably have a zero error, because after all, healthcare delivery is by human beings, and to err is human. But you, all you can do is bring down the percentage of the errors to the least minimum, so that it does not cause harm. So what happens when an institution is accredited is because you keep measuring your outcomes. And some of these I would say is the number of errors, whether it is, say, medication errors, the right medication to the right patient in the right dose at the right time. This becomes a norm. Every nurse is trained to make sure, are you giving the medicine to the right person, which is the first thing that is important. The right dose, the right route, the right time. All that is very important. So you keep following up, training people. So automatically your errors for the case of a medication becomes much lesser. A second example I would say is that infections. Now, when patients come into it, you are in an environment where you would have other patients who might have some infection or the other, but you follow very strict protocols to ensure, because patient does not come to a hospital like he goes to any other place for vacation. He has to come because he is sick. So you can have people with varied infections coming into the hospital. Some hospitals may have the luxury of having individual rooms with individual patients, single rooms. Now, when you look at hospitals, there are hospitals which might have general ward beds. May not be possible to have everybody having single room. You might have twin rooms. You have three-bedded. You may have even 5 to 6 beds in a room. Now, how do you take care of them? You have to put in very strict practices and ensure that hand hygiene, simplest of the lot. Hand hygiene is followed by every person, whether it's a nurse or a doctor, when you move from one patient to the other. This is when there are large number of patients. One thing that accreditation helps you is to reduce this so-called hospital-acquired infection. He already might come to the hospital because he has to be treated, but he doesn't want some more infection coming from the hospital. So there definitely is very large reduction in the hospital-acquired infection. This becomes another very tangible one that does. The third example, there are many that I can say, but the third very strong one I would say, in addition to the infection errors, the third is your practices in the operation theater. Very, very important that you do a proper check before you take a patient. And most important, surgery being performed on the right patient. So there is a ritual that is being followed, which is called as a safety checklist. Just like in the airlines, it's very important that it's the right patient, you're performing the right surgery, you're doing it on the right side of the body. So every aspect of it is checked, and you have a checklist where everybody, the surgeon, the anesthetist, the nurse, the entire team will not touch the patient till each one of them is checked. And then they say, yes, are we ready? Then they say, yes, let's start. So that is a safety. So you can minimize it. And these are what are called as events that should never happen. We call it as never ever events. And these are the ones which are taken care of when you have these strict practices. So if you say, how does accreditation help you? These are the standards which are put in place, and everybody follows it. You may do 10 surgeries, or you may do 100 surgeries, or 50 surgeries in a day, but you don't take a patient and start the surgery unless you have followed these practices. So that's what I would say, measures which help you in improving the care. That is what I would say has been some of them. As I said, I can go on. It could be length of stay, because your complications become less, infection becomes less, stay is less. Nobody wants to come into the hospital and spend their time here. We want to get onto the bed, get out of the bed. That's what I would say. So length of stay becomes very, very clear as what is required in the care of the patients. And last but not the least, I find that accreditation has improved communication. At the end of the day, the patient wants to have the best communication from the healthcare provider, whether it is a doctor or the nurse. So accreditation again helps you to keep on training people and say, you need to explain what is the patient problem. That is what we say. And we say every patient would like to know, what is wrong with me? Why am I here? What are you going to do to me? These three questions we always say, tell the patient, please ask. This we call it as ask me three. And we tell everybody, these are the three. And when the patient gets admitted, we say, please ask these questions so that you get all the inputs. So these are some of the standard. It comes under patient education standards. So as I said, probably there are n numbers that we can go on, but these are the very, very important aspects which helps a patient when he comes for care in a hospital.
Dr. Malathi, very beautifully explained. But since you began the conversation by saying that, at the end of the day, the doctors and the nurses are human beings, and there could be chances of error that could be there. Do you think that the technology advancement that is happening today, with the checklist being there, everything needs to be marked in, and then you get an approval, green signal, or for that matter, even when you're screening a patient, so you don't miss out on something just because your mind is somewhere else. Do you think technology is helping in minimizing these errors?
Absolutely, absolutely. Because there are certain things which you can minimize because you bring in technology. So a lot of things are now inbuilt into your system itself. And therefore, you have different things. Some of them, which are the checks that can happen. So we have guidelines which are already in the system. So when the doctor looks and examines a patient, comes to a diagnosis, there are guidelines which prop up saying, have you checked this? Have you made sure this has been done? Are you sure you want to look at it? So it gives quickly an idea up to a person, though the final diagnosis and treatment is a prerogative of the healthcare provider. But these are prompts. But a very important technology that has helped immensely is in medication, because the number of errors on medication are the highest that can happen, because a lot of human intervention comes in, starting from prescription that comes in, where the doctor writes the prescription. So you can have an illegible writing. You can probably put a decimal which has to be before, which has to be put like 0.05, but you miss out a decimal and the nurse reads it as 5 instead of 0.5. Now, this can happen. You might have two drugs being given to the patient which tend to interact with each other, or you may have two drugs which are creating an overdosage. Now, in the system, you have an inbuilt system which every time you put a medicine into it, it pops up. and make sure that it becomes a legible writing, it is into capitals, and automatically the dosage is adjusted because there are ways for a particular condition it should be administered. And very, very important, it pops up and says, there is another medication which is going to now interact with the medication already being given to the patient. Please check. It will not only check and prompt you, but it will prevent you from even writing into it. So that it is, even if the doctor wants to overwrite, this is a mistake that can happen. It will not allow you to enter it into the system. So these are very hard stops that can happen. Some of them could also be mere suggestions. So this is one way where it has been tremendously brought down the medication errors, particularly from the point of view of legibility, because of the fact that many of them have the habit of a cursive handwriting, and it is very difficult to understand the drug, some of the prescriptions, if you would see. So this has been brought down to a large extent, but this form of technology. Another very, very important is bringing in now, as I would say, the buzzword is AI. So a lot of hospitals have gone on to what is called as clinician support decision making, where it would tell you based upon it, these are the options which are there. Maybe this is a diagnosis you want to look at. These are the investigations. So there's a lot of prompting that goes on. Though AI cannot take up and say that this is the diagnosis, it is not going to replace the doctor. But what is important is to give you prompts that come in, which is very important. So improvements have happened in the electronic records, which is very, very important, bringing in such support systems, errors being reduced, and a lot of audits are now done online. So incident reports, very, very important for us in healthcare. We keep emphasizing that reporting incident is actually a blessing. And I always say it is a window of opportunity. Normal fear is that would there be a problem because I report an incident? But hospitals now have gone on to say that please report. It will help us to improve. And incident reporting has become online. Earlier, someone would see, someone would enter, then it would take time by the time you start closing. Now, you get just a needle stick injury to any incident, it gets into the portal straight, goes to the concerned person, they put in corrective measures. More important, we look at prevention. So all of these have been constantly with technology coming in to many of the hospitals, particularly important to bring down errors as much as it can.
And Dr. Malathi, I believe that there are a lot of challenges that hospitals typically face while obtaining and maintaining the accreditation. And
Absolutely.
how do they overcome these challenges, in your opinion? You worked in India, you worked overseas.
Yeah.
What is it that you have observed?
Very, 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 very pertinent question, I would say. Yes, one is to get the accreditation. Now, everybody was very happy that you are going to work together, you're going to get the accreditation. It's wonderful to get the seal on the hospital and to put there whether it is your gold seal or whatever might be the color of the seal. And now patients also recognize every one of these seals. So first and foremost, the moment you put that seal, I always tell everybody now patients' expectations are also going to go up because he knows that you are an accredited. You're expected to have standards into place. That is the first thing. So that means you have to make sure that every time your processes are going to be the best processes. You cannot say that, okay, today I did a great job. Tomorrow it's okay, let's take it little lightly. No, because tomorrow's patient is a different patient. So every person would expect the standardized processes. Now the challenge starts, which is sustainability. Getting it first is very, very easy. But the most important is you are expected that it should be the same. So sustainability is a challenging. Why a challenge? Number one is because there's always an attrition of the staff. A lot of the accreditation processes, training, all happen because of the human resource. And you know that nurses to a large extent, to lesser extent, would be the doctors, and there would be movement of these people from one organization for various reasons, which means you have a set of new people coming in. And that would mean, again, putting in systems into place, getting them trained to see to that they come to the same level. So that's the first challenge. The second very important challenge is every time there might be a revision of the standards. There could be new technology coming in, and that would mean acceptance of change. And I'm sure you would agree with me, any change for that matter, there is going to be a resistance, but I don't say that it is impossible. But you would have to convince people and say that this is required, this is necessary. The transformational change again takes a little more time. The third factor that is important is the quality always comes with some cost. And therefore, implementation, you require to put certain systems into place. You may want to bring in new technology into place, which is very, very essential. You might have to improve your facility because you want to make sure that patient doesn't have a fall. You need to provide rails everywhere. You want a call bell system in every place where patient can access. If I want to, every washroom has to have a call bell. Your HEPA filters have to be cleaned. You have to get your water analysis done every month to make sure it is done. You might have to put the best of the chiller system, generators. You can imagine every one of these is necessary. You can't have a system where the generator can fail and my fridge has got medicines which can totally get wasted and lose its potential. You might have a patient on a ventilator. What do you do now? So you need to have backup systems. To have all of these systems comes with a cost, but it is important that that is what you require because patient has come to you saying because he believes you, and that's what is all accreditation about. But if you have to maintain that sustainability, that's where the challenge comes in. So that is why we say quality is a top down approach, which means the governance, the leadership, they take the initiative. They believe safe care is the goal or objective of my institution as a healthcare provider. So I budget it. I know that every year there is a certain portion of it, of the budget, that has to be aligned towards accreditation, quality, safe care. Once you do that on a regular basis and there is a surveillance mechanism, then it becomes an easy path. But that takes time, understanding, and that is why we say that quality has to become a habit for the organization, and then it becomes sustainable. So that's the challenge.
I think I completely agree with you, Dr. Malti, because I believe that uh, it is a mindset that needs to be transformed, because it can become a habit if you firstly believe that quality and patient safety has to be paramount and whatever needs to happen must be done. And I completely agree with you that it's a top-down approach, that if the leader believes in this genuinely, it will become important for everyone else to ensure that they follow it to the T. And
Absolutely.
Dr. Malti, for an average person, when they come to an hospital, so we understand you listed that, what are the different parameters or the important metrics that have to be maintained by the hospital. But what are some of the indicators that the patients, when they come to the hospital, or their families, when they come to the hospital, for an average person, what is their expectation of quality and patient safety?
Very well said. Because what is important, Harbinder, at the end of the day, as a common person, I would say, yes, you have the seals, very nice. I can see it's very, very good. The gold one is there, the blue one is there. I can see that you have every year on year you have got it. But I, as a patient, what is in it for me is the first question I would like it to be answered. And what does a patient look for? Number one, if I take a patient's journey, the patient comes into the hospital, and it is important that every encounter in the hospital, it's something like a touch point for a patient. One might say that I have given the best of the service, best of the hospital, but if you have a person who is unable to get into the lift because the lift itself is not working properly, for the patient, he would say accreditation is fine, but I've been waiting here with the patient on the stretcher and your lift has not come still. So what is he looking for? So patient coming into the hospital, first and foremost, all that he says is, please don't make me wait. This is what an average man will say. Because if it is a shop, it's very easy. I find that this happens to all of us. We get into a shop and the person is not even asking, what do you want? We say, okay, forget it. I can go to the next stop. Because I always say that the boss is actually the customer, because he can easily go elsewhere and spend his money and your hospital will close down. So first and foremost, expectation is there should not be a waiting time. I'm ready to wait, but please tell me how long. And tell me that this is what is the reason. Why are you making me wait? When we insist that there is an appointment system, which is one of the standards you follow, why give me an appointment and then say, wait? Then I could as well be a walk-in patient. So what is his expectation? He says that if your hospital has good standards, please make sure that give me a buffer. I'm ready to wait. Another 15 minutes, I'm fine. I'm ready to wait. But please, expectation management becomes important. So that's the first thing, waiting. Number two, what is he looking for? He's come to see a doctor and he says, please give me some time. Give me some time and listen to what I have as a problem. It cannot be that you come in and you're ready with a prescription. Even before I start saying my problem is, your prescription is already in the hand. So what is he expecting? He says, give me time to listen to my problem. Allow me to ask questions. That's all the average man says. I am ready to follow your treatment, but please tell me, why am I supposed to do this? And you can't suddenly say that this is your problem. Just tomorrow, can we get you into the operation theater? Give me some time, please allow me to understand. Is there anything else I can do? Is there an alternative can be done? What is the cost? Please tell me the exact cost, at least close to it. I don't expect the cost to be exactly to the last penny, but please tell me so I can prepare. So what is his expectation? Expectation is listen to me and please answer my questions. Tell me what are my alternatives. Tell me what I'm supposed to pay. Communication. And finally, he says, educate me, please, so that I can do well the way you want me. So his expectation from a hospital of accreditation is just to say you have good standards and then say that, please, I should have a mechanism here where I do not contract infections from here, where I have more problems that will happen to me. That is where we say that accreditation means you're not going to give a hospital-acquired infection. You are not going to have a wet floor where the patient is going to slip and fall and have a fracture. He came with something else, landed with something else. So his expectation is to say that treat me well, number one. Number two is make sure that the treatment is accurate. I know that you are all human beings, but it should not be that I keep coming back to you because you have not been able to diagnose. Make sure it is timely. Make sure that I leave the hospital and my discharge process is not painful. That is what is extreme. That is why I said, make it easy for him to get in the bed, make it easy for him to get out of the bed. That's all that he is asking for, nothing more than that. That's all is for an average man who says, treat me correctly, treat me for the right problems I have, make sure that it is safe care and I don't land with more problems. I don't come back to you with various complications. That's all is the average man. And that is the safety net that you put into place in accreditation.
I totally agree. I think it is, managing the expectations is one thing, and also increasing predictability of the experience. I remember I used to be doing branding for hospitals, doctors, and when I was talking to them, I used to tell them that, listen, the doctor is the last person they meet when a patient comes in. Until that, he has already had an encounter while parking his car, coming in, registering himself, talking to two people before he meets the doctor. So he's already created his perception of what he can expect. So it's not just limited to the doctor, but every person in the ecosystem that is there.
And if I may add here, Rabin,
Yes.
there's something which I thought was very important to bring it out at this point in time. We have always been talking about outcomes, measures. Now there is a change, or I would call it, you call it as a paradigm shift. And I believe that is extremely important. And what is this? Measure the outcome from a patient's perspective. We talk about a lot of outcome measures. We talk about the waiting time. We always talk about the door to balloon time. How much time he came into the emergency? How much time did it take to get into your cath lab? So on and so forth. But I always say, Are you measuring the outcome from a patient's perspective? That is what is important. You might do a phenomenal TKR, a total knee replacement. Doctor is extremely happy, no infection, fantastic. The clinician says, my length of stay is 1.5 days. Superb. But I always say, what does a patient have to say about the surgery we have done in the hospital? How is his pain? How is his stiffness? Is he able to climb one step of stairs? And that is what is important, if I would say, Harbinder, is we are now looking into an era of what we call as patient-reported outcome measures, which is called PROM. This is something that has become the norm in many of the hospitals. And we and the part of accreditations are working now to see that can we have PROM for every type of condition that we treat in the hospital, where you from the hospital will give me the outcome, but give me what the patient said to you. What was his outcome? And this is very important because a patient will tell you, my stiffness, he says, I could raise your leg to 40 degrees, but the patient says, I'm able to move only 5 degrees, doctor, when I go home. That is what is important. If your clinical outcome matches your patient outcome, the moment the two of them are separate, if you plot it on a graph, if this is the clinical and this is your patient, you're far away. Because after all, who decides that you are the best? And that is always the receiver, not the provider. So you have to make sure that the clinical outcome slowly matches with his. And if the two come together, that's the success story. And that is what is all about safe care. So we have now trying to move into PROM and PREM, patient reporting experience measure. How did I experience what is happening to me in your hospital? That is one of the norms that have come into accreditation standards. That's why I said I wanted to bring that up, saying how the journey of accreditation moves from the provider more and more. That is why we say now healthcare is patient driven and not just patient centered. So I just thought I'd bring that point, which is an aspect of accreditation as well.
This is, this is absolutely important. I'm so glad that you brought this up. With that, Dr. Malathi, my last question to you is, since we're talking of quality, we're talking of accreditation, we're talking about patient centricity and patient-driven outcomes, how synonymous is quality to accreditation? Is accreditation a mandate for quality of services, or is it not? And should it be or should it not be?
Yeah, I'll answer it in two parts. First and foremost, it is not a mandate. You cannot say that unless you have accreditation, you can't have quality. It is not correct. But what is important is that everywhere in all the geography, most of us probably do better when we say that this is mandatory for you to do. That is what is important. Why do we bring this is because it is so critical, so crucial for delivering safe care, that unless you bring in certain mandates, you give that, you do not, there is a complacency which sets in. Okay, it is all right for me to do this. That is what happens in every walk of our life. The moment you say, no, this is what you need to do, you have to do it. Then you don't have to do it for everything, but those which are very critical, like healthcare delivery, where it is life and death, you get one chance for the person to be alive. And in such a situation, if you do not make certain things mandatory, then you may not be able to give the best to the patients. And that is why making it mandatory sets the framework, and therefore it gives you safe care. But at the same time, there are institutions which may not be following it up. But for it to become sustainable, for it to be standardized at every walk of life, that is accreditation, making it, because if it is not mandated, I may do a great job today, but tomorrow I'm not very sure that you're going to give the same delivery of care at all. But if I say, this is it, this is the way you will administer medication every day to every patient, mandated, non-negotiable, then automatically in such an industry, it becomes important that it should have an element of be making it mandatory. Now, across, for instance, India, NABH is made mandatory. Now, that has brought such a change. in the care delivery system. So where even here in this part of the country, it is very, very important that every hospital has to be having a accreditation or you lose your license. Now that's wonderful because unless you do that, it comes with a penalty. Everything is there where either you have a stick or a carrot. Only then it works. And it is with good. The outcome is important. Here it is you're taking care of a person who is trusting you, who is believing you and walking into the doors of the hospital, saying that you are going to take care of me. And therefore, if I have to make sure and tell him, yes, it is, I'm going to give you, I have to make it mandatory. And that is the importance of it.
I think it is, no, I think it is very, very, aptly you brought it out, because while we spoke about quality being a mindset of the top leader, and it does have a trickle down effect, but to make it sustainable and be, and make it a sense of responsibility or accountability, then you have to make this as a mandate, so that, there are no slippages. And also, we've seen that institutions have a life beyond any individual. So for the culture of safety and quality to move on sustainably across years, then I think, and also it brings down what you spoke about, the faith in the hospital, that a patient comes with that trust that yes, this hospital is following these procedures or is expected to follow these procedures. And Dr. Bharti, in your conversation, there were two, three things that really stood out, which was when you spoke about the impact on communication of the patient, where you spoke about the three questions that they must ask,
Yes.
so that they can ensure the care that they really expect from the system and get all the information that they should typically have.
Absolutely.
I was attending a conference just day before, a talk by a Nobel laureate, and he has done a research, and he finds that in India, especially, the average time spent by a physician on a patient is 2 minutes, and in those 2 minutes, he has not even touched the patient. So I think we need to change that, and accreditation could make a possible difference in this. And what you spoke about, the concept of PROM and PREM, the patient reported outcome measures and patient reported experience measures, both are, I think, will transform the expectation of the patient that the institution must be aware of. So
Absolutely, Harbinder. I would like to have the last one point that we now are looking at asking the hospitals to engage in is something called as patient advisory or advocacy committee. You have so many committees which take like infection control committee, the pharmacy therapeutic, so on and so forth. I said, how many of us have a committee in which the patient is a participant? We talk of so many things in every committee, and all of it is for that patient. And I said, in any one of the committees, do we have one patient who gives us an idea of what we are supposed to do? I said, isn't that something very, very unusual that we have never involved a patient? And I said, it is time you have a committee in which you have the CEO, you have the various leaders, you have your medical people, including the medical director, the nursing. You should probably have your service excellence committee person who takes care of service excellence, but include at least 2 to 3 loyal customers of yours. Why I call them loyal is because they trust you. They believe that you are going to do the right thing. They are going to tell you what is the right thing that you have done, which is very good, so that you can continue. But they will also be the people who will tell you this is an area in the emergency which is actually a problem. Maybe you want to look into it, because it's an external pair of eyes who trust you. Therefore, take them. And I said, you might probably want to have a meeting maybe once in a quarter. Call these 3 people and tell them, one could be a who has undergone a surgery, one could have come through your ER, one could have come to your outpatients, and say, tell them, What is it that I can do better from your perspective? And I'll give you a very clear-cut example of a hospital where I walked into and I looked around. I said, wonderful, you've got a new dialysis unit. I said, that's excellent. And then I was looking around it and I said that you are supposed to weigh, the patient has to be weighed before and after the dialysis because that's how the treatment is and things like that. But the area was so small that a person who is on a wheelchair wouldn't be able to get into that place at all. And then the question that I said is, when you started the dialysis, who are all the people who came into the discussion on the dialysis unit? Wonderful. You had your engineer who designed the dialysis, someone else who talked about the machine, the nephrologist who was concerned, so on and so forth. I said, did the patients were already undergoing dialysis for you in your ICU? It would have been very easy to talk to the patient and say that, what are you looking for when you come for dialysis? And you know what the patient said? I said, let's call two of them. And the person just said, we lie down here for 3 hours and we have nothing to long for. In fact, we are thinking all the time, will I have to be like this throughout my life? Because they're all chronic kidney failure patients. And said, then I feel like I get so depressed during those 3 hours. All I am looking for is if there was a monitor where I can look at something which will keep me busy. And I said, all that was required is have one and put a small little screen, and you don't have to put for everybody one. Then there's a problem because each one is wondering, why should I be looking at something not interesting? And I said, put an education material there. Tell him what is it important about your diet. Talk to him about something which is useful for him. Make him feel good about what he is undergoing. And I said, that'll be wonderful. And then the engineer tells me that, madam, it's very difficult now because the lines have already been laid. See, why are we lost? We lost because we could have just asked this patient what could have been done, and we could have probably put it in instead of saying that now it is difficult for me to draw a line to put a computer over there. So what I'm trying to say is the patient plays a very important role, not only in receiving care, but he is going to contribute to you providing care. That's what I said. Make him a part of as a provider itself. So that's something I call as the patient advisory or advocacy council. And I said, all the education material, have you ever asked a patient, does he read it? It's supposed to be patient education material. And if he doesn't even want to read it, what is the point in printing and giving it to him? Ask him, is this useful to you? And you know, one of the patients told me, more than this, madam, please tell me 5 questions I need to ask your doctor. Give me that education. I'll go in and ask him those questions because sometimes I don't know when the doctor says anything you want to know, and I don't know what to ask him. And I said, that's very important. Give him 5 questions and give it to him before he enters and tell, please, these are the questions you should know when you're going for your care. So I think that's how we have to move into more and more bringing in the patient, not only saying that it is patient driven, but making it happen.
Dr. Malathi, this has been so enriching for me itself. I mean, apart from the fact that we were just taking an interview, but this has been a very enlightening conversation because each of us, whether we are in the healthcare or not, one day we are a patient who needs healthcare. You know, so I think it is really important. Thank you so much for taking out time. I know it was a little early for you in the morning
Not at
in
all.
Dubai, but thank you so much for being here.
Thank you so much. And thank you for those wonderful questions. And thank you for really, I think what I enjoy best is when someone wants to know about what you want to do. I think that's the best part of any conversation. Thank you so much. Thanks for
so
your
much.
time.
Thank you so much.
Keep in touch.